EBV receptor. A 17-year-old male presents with sore throat, fever, and generalized lymphadenopathy. A heterophile antibody test is positive. Which of the following host cell receptors does the causative virus use to enter B cells? A. CD4, B. ICAM1, C. CD21D, ACE2E nicotinic acetylcholine receptor. Correct answer C. 21. Explanation: Epstein-Barr virus, EBV, uses CD21 to enter B cells. A. CD4, used by HIV, not EBV. B. ICAM1, receptor for rhinovirus. D. ACE2, entry point for SARS-CoV-2. E. Nicotinic AChR, used by rabies virus. Question 2. HIV receptors. A 28-year-old man is diagnosed with HIV. Which of the following is the primary receptor the virus uses to attach to host immune cells? A. CCR5, B. CD21, C. ICAM1, D. CD4, P antigen. Correct answer, D. CD4. Explanation: HIV binds to CD4 first, then uses co-receptors like CCR5 early or CXCR4 late. A. CCR5, a co-receptor, not the primary binding site. B. CD21, EBV receptor. C. ICAM1, rhinovirus receptor. E. P antigen, receptor for parvovirus B19. Question 3. Parvovirus receptor. A 7-year-old child presents with a slap cheek facial rash. Which of the following receptors is used by the causative virus? A. CD4, P antigen, C. ACE2, ICAM1, ECXCR4. Correct answer, B. Pantogen. Explanation: Parvovirus B19 uses the P antigen found on erythroid precursors in RBCs. A. CD4, used by HIV. C. ACE2, used by SARS-CoV-2. D. ICAM1, rhinovirus receptor. E. CXCR4, co-receptor for HIV. Question 4. Rabies virus receptor. A man is bitten by a bat and begins to show signs of agitation, hydrophobia, and confusion. Which receptor is used by the causative virus? A. CD21. B. CXCR4. C. Nicotinic acetylcholine receptor. D. Integrins. E. P antigen. C. Nicotinic acetylcholine receptor. Explanation: rabies virus binds to nicotinic ACH receptors at the neuromuscular junction. A. CD21 EBV receptor. B. CXCR4 HIV co-receptor. D. Integrins, receptors for CMV. E. P antigen, parvovirus B19 receptor. Question 5. Rhinovirus receptor. A 5-year-old child has a runny nose, low-grade fever, and sore throat. The virus most likely uses which of the following receptors to infect nasal epithelium? A. ACE2, B. ICAM1, C. CD21, D. CXCR4, E. P antigen. Correct answer, B. Explanation: rhinovirus enters cells via ICAM1. A. ACE2, used by SARS-CoV-2. C. CD21 EBV receptor. D. CXCR4 HIV co-receptor. E. P antigen, parvovirus B19 receptor. SARS-CoV-2 receptor. A patient with fever, dry cough, and shortness of breath is found to be positive for SARS-CoV-2. Which host cell receptor is the virus known to bind? A. Integrins, CD4C, ACE2, D. ICAM1, P antigen. Explanation: SARS-CoV-2 binds to ACE2 receptors, highly expressed in lungs, heart, and GI tract. A. Integrins, used by CMV. B. CD4 HIV receptor. D. ICAM1 rhinovirus receptor. E. P antigen, parvovirus B19. Question 7. CMV receptors. Which of the following host structures are used by cytomegalovirus CMV to infect host cells? And CD4. B. Integrins and heparin sulfate C. ICAM1 and CXCR4. D. CD21 and P antigen. E. Nicotinic acetylcholine receptor and C4. Correct answer. Correct answer, B. Int and heparin sulfate. Explanation: CMV uses integrins and heparin sulfate to attach and enter host cells. A. ACE2 SARS-CoV-2 CD4 HIV. C. ICAM1 rhinovirus CXCR4 HIV co-receptor. D. CD21 Egan parvovirus. E. Nicotinic AChR rabies CD4 HIV. Let me know